Measuring satisfaction is typically done in most organizations in 6 areas. The inpatient, which is done using an HCAHPS survey. The outpatient area, which is done with different instruments, but typically the CMS approved survey is called CGCAHPS. The home healthcare environment, the emergency department, pediatric areas, and psychiatric services. These are the 6 big buckets of patient satisfaction that CMS and payers are generally interested in. Currently, the things that affect physicians the most are in the inpatient environment and in the outpatient environment. And let me be clear, measuring satisfaction on the inpatient environment is done with a survey, and there are different instruments. The most common instrument is the HCAHPS survey instrument, which is a Medicare-designed, Medicare-approved process, which I'm going to talk about in a minute. The outpatient environment, likewise, is surveyed with a variety of different types of instruments. The CGCAHPS instrument is one developed by Medicare and eventually will be used to measure physician performance around how they communicate with patients in the office environment. There are different vendors that are approved to administer the HCAHPS survey. We often hear the terms Ganey or the Ganey survey. The Ganey is a large survey organization that administers surveys. The HCAHPS instrument that Ganey uses to measure inpatient satisfaction is the instrument developed for Medicare and required by Medicare as part of the value-based purchasing mechanism. So again, let me reiterate this because it's often a point of confusion. Inpatients receive a survey. That survey instrument is typically the HCAHPS survey, and that HCAHPS survey is administered by a vendor. There's a lot of vendors. There are 67 vendors that are accredited by Medicare to administer the HCAHPS survey. Ganey is one of those vendors, and that's one that we typically hear associated with the HCAHPS vendor. Examples of the HCAHPS doctor communication questions are the following. During this hospital stay, how often do doctors treat you with courtesy and respect? During this hospital stay, how often do doctors listen carefully to you? And during this hospital stay, how often do doctors explain things in a way you could understand? Again, it's important to understand this process. The HCAHPS survey is a survey of standardized questions that patients receive when they leave the hospital. There are several areas that the HCAHPS survey covers. One of them includes how physicians communicate with patients. It's called the physician domain. These 3 questions make up the physician domain. These are what are required by Medicare, and these are linked to the value-based purchasing initiative currently in place across the United States. And it is pay for performance, the process that's used by Medicare that collects this data to determine a hospital's performance overall against other hospitals in the United States. When you look at how this process is implemented, patients are given 4 choices to each one of those questions. They can answer always, usually, sometimes, or never. It's important for us to understand that the way patients answer affects how your scores are reported and hospital scores are determined. The only response that are taken into consideration is if they answer always. This is what's known as top box response. So if you ask the question, did the doctor treat you with courtesy and respect, and you give the patient the choices of always, usually, sometimes, and never. If the patient doesn't answer always, that question doesn't count. So I gave you the 3 questions that relate to the doctor domain. If the patient answers always on one question, usually and sometimes on the other 2, the overall score for that physician from that questionnaire is 33%, which places them in the bottom 5th percentile nationally for communicating with patients. This is called, as I mentioned, top box response. It may not be the most appropriate mechanism to use, but it is what Medicare requires. And it's really very important why physicians need to understand this methodology. Because if they don't drive communication to the always response, it will negatively impact how they're rated from a communication standpoint. And when you think about where we're moving with transparency and how data like this is used, there's no question that this information will eventually be available to consumers. And it is why all physicians need to pay very close attention to what this process is. CGCAHPS, or Clinician Group CAHPS, is the standardized CMS-approved survey for the ambulatory environment. Currently, CGCAHPS is not a requirement of CMS. However, I can tell you with certainty it is on their agenda. And up until now, CMS has only had a way of measuring satisfaction on the inpatient environment. They haven't been able to go to the ambulatory environment, primarily because of all the private practice physicians in the United States. The CGCAHPS survey is the solution to that. This is what they want to implement for all physicians across the country. And let's look at some of the questions. During your most recent provider visit, how often did your provider explain things in a way that was easy to understand? How often did providers listen carefully to you? How often was it easy to understand information about health questions and concerns? And again, the methodology that they use is the same. Top box response only always counts. So it's very important that physicians understand this process. I don't think there's too many physicians in the United States today that believe that this process is validated or fair. I certainly don't. However, it is our current reality. And as much as we disagree with it, we have to understand how it works so that we can improve it. Overall, I don't think anyone in the audience or anyone across the country would say paying attention to the patient experience is not important. It's the right thing to do for us. There's no question that it's the way that we would want to be treated, and it's the way we would want our families to be treated. Who can argue that physicians should not improve the way they communicate with patients? At the end of the day, it really is about patient-centered care and family-centered care. Again, it's the right thing to do. And also, patients want it. It is their quality. It's not something that we have always thought is important. We have always been very outcomes focused. Did the patient survive? Did they have a complication? That's what we pay attention to. But patients don't see that. They pay attention to things that they can understand. As I think the McKinsey study and other studies indicate, that's what patients understand as being important to them. That's their world. That's their quality. So make no mistake, it is the right thing to do. It's how we would want to be treated, but it's what's important to patients. Also, at the Cleveland Clinic, we think it's helpful to define the importance of patient experience as part of our brand. We want patients to come here to have a very safe experience. We want them to have a great medical outcome, but we also want them to be satisfied in their care. That's part of our brand promise to our patients. And I would argue that for most of you, it's part of your brand promise as well. What I tell physicians that I talk to in my organization is we should pick a reason on top of the list to pay attention to this. But for the people that don't believe that this is important for the right reasons, you have to understand something very clearly. The government is saying this is important, and now they've linked it to reimbursement. So we really don't have much of a choice. So we should drive it because it's the right thing to do. It's the way we would want to be treated. It's patient's quality. But for people that don't believe that or don't think it's the right thing to do, understand that this is the environment. This is what the government says is important. This is what payers say is important. And they are watching us, and they're going to hold us accountable to it, not only in terms of things like credentialing, but financial reimbursement.